And now to a story that continues to ignite passions from both sides of Congress. This week's controversial Supreme Court ruling on health care is a victory for President Obama, but is also galvanizing Republicans who will be working to repeal what they say could be one of the largest tax increases in history and force insurance premiums to go up. All of this is happening against the backdrop of the upcoming presidential election. Joining us now for a fair and balanced debate are Democratic and Republican congressmen who are well-versed on this issue. Congressman Eliot Engel of New York, John Fleming of Louisiana, Tom Price of Georgia, and John Garamendi of California. Gentlemen, welcome to all of you. Thank you so much for being here.
Good afternoon.
Thank you. Yeah, good to be with you, Ma.
Well, it's been a historic week here in D.C. with the drama over affordable health care far from over. I want to break it down first on what direct impact this is going to have on people seeking help from doctors and hospitals. Let me begin with you, Congressman Price. You are an M.D. Will a trip to the doctor now change for good?
Well, what we've seen just with the current law that's been instituted is that premiums have increased. And in fact, accessibility is going down, and people that thought they could keep their health coverage can't because employers are shifting individuals away from the kind of coverage that they had before. That along with the uncertainty in the market makes it so that it's going to be much more difficult for patients and doctors to have the kind of care that they know they ought to have. We believe that patients and families and physicians ought to be in charge of health care, not Washington. And that's the distinction. That's why we believe so strongly in repealing the law as it currently stands.
It's expected, though, that within the next decade there's going to be a large shortage of doctors with millions of more people seeking health care. Congressman Fleming, as a doctor yourself, are you worried what impact this could have on the system?
Well, absolutely, Uma. And again, just to reinforce what Tom said, is that it's one thing to have a card that says that you're entitled to health care, that being an insurance card, Medicaid card, or Medicare, but access is a whole other issue. And what we see with this is long lines of rationing and the inability to see a doctor in a timely way. We've seen this in other countries, even the state of Massachusetts, which has, again, as you say, a plan that's very similar to this one nationally, has longer and longer waiting lines. 50% of primary care doctors are not accepting new patients. So access is going to be a big problem, and that's not to mention the massive cost, a middle class tax increase of as much as $800 billion over 10 years.
Well, I know that Congressman Eliot Engel is going to disagree with this, but there's also a war of words over what to call the fine that's going to be attached to the federal health care overhaul's most controversial provision. Is it a tax, as the High Court ruled, or a penalty? Congressman Engel?
Well, I don't think it matters what it's called. What matters is that the Health Care Act is standing. And what my colleagues have just said, I think, is more the scare tactics that we've heard now for the past 2 years. The bottom line is that we currently have about 50 million Americans who are uninsured. You want to know what a tax is? A tax is when they go into the emergency room and you and I have to pay for it. That's a tax. What this Affordable Health Care Act is going to eliminate that, because everyone is going to have insurance, and this so-called tax is only going to affect those people who don't buy insurance, who can afford to buy insurance, and don't buy it. So the average person that has insurance, this is not going to affect them one iota. The bottom line is that the current health care system is not sustainable. Costs have increased, doubled, and even tripled in some instances in the past several years. And what the Affordable Health Care Act will do is it will provide health coverage for all Americans. Whatever happened to the Republican mantra of personal responsibility? I don't think it's very responsible if someone doesn't want to have health care and then gets hit by a car and demands that you and I pay for it.
Well, Congressman Garamendi, it doesn't matter, as your colleague just pointed out there, it doesn't matter what you call it, a tax or a penalty. I mean, the House is getting set to vote to repeal this act on July 11th. Does it really have any muscle at this point, since the Senate says it won't set a vote at all? And if that's the case, where does all this debate go?
Well, just a lot of it is a lot of fuss and fury. The bottom line is that Americans are already far, far better off as a result of this law. We already know that some 13 million Americans have received some $7 billion of rebates because the law forces the insurance companies to charge an honest price. We know that some 42 million seniors have already received preventative health care services. blood pressure checkups, diabetes checkups, all of those will reduce the cost if you get to the illness early on. We know that there's 6.6 million children that are still on their parents' insurance rather than being tossed off at the age of 21. We know that this is a very, very good law. I wish I had this law when I was the insurance commissioner in California, because this law ends the ability of insurance companies to discriminate against women simply because they're women and might have a child. This is a really good law because it does end insurance discrimination. With regard to the number of doctors, my friends there on the Republican side have actually reduced the ability of this nation to educate doctors. They have cut the residency, the money for residencies across this nation for family health care providers. You can't say there's going to be a shortage of doctors and then go out and cut the money to educate doctors. That's just not right. That's hypocrisy.
Congressman Price, you want to respond to that?
Yeah, Uma, I know my friends on the other side of the aisle like it because it is, in fact, a tax. The fact of the matter is that this law violates every principle that we hold dear about health care, whether it's accessibility, as Congressman Fleming mentioned, or affordability. The prices are going up on premiums, quality is coming down, and choices for patients are going away. Now, that's the bad news. The good news is that once we repeal this, there are wonderful solutions to the health care challenges that we have that don't require putting Washington in charge. We can get folks covered, solve the insurance challenges, and save hundreds of billions of dollars in health care, all without putting Washington in charge of your health care. That's what the American people want. That's why they had such frustration and anger after the ruling on Thursday.
All right, you want who's
just hang on a
in?
second.
Okay, go, Congressman.
Yeah. Well, Washington's not in charge. Washington has figured out how to finance the system. The same people are in charge that have been in charge. The insurance companies are in charge, but what the insurance... I'm sorry, but it is true. It is true. Washington is not in charge of anybody's health care.
Yeah.
The Medicare program continues as it was in the past. Well, wait a minute, guys. Wait a minute. Let me finish here. The Medicare system for seniors stays as it was before. The only difference is benefits have been increased.
Let me get a last word.
$500 billion was $50 million.
Give everybody equal time here. Let me get a final thought from Congressman Fleming here on responding to your points.
Yeah, this is an absolute top-down so-called solution. This takes the responsibility and the privilege and the decision-making from the patient and his or her doctor and puts it squarely in Washington with 15 unelected bureaucrats. Americans 2-1 despise
That is simply not true.
All right, Congressman Elliott,
that's simply not true. I'm sorry, it is not true.
The bottom line is this, that right now insurance companies control the whole thing. They decide who they'll insure. If someone has a pre-existing condition, they won't insure them. They don't like the idea that if you're 26, you can still stay on your parents' insurance. They don't like the idea that health care is expanded in terms of coverage. So right now the insurance companies are calling the shots.
All right.
With this bill, the American people will call the shots.
And it's
nonsense what my Republican friends are saying.
It's very clear.
It's the same scare tactics. You know, they wanted the Supreme Court to decide. The Supreme Court decided that the law is constitutional. Now they want to repeal it.
It's very clear that the passions continue to run very high. The passions continue to run high on both sides, as we've been pointing out, and as our viewers can see there. Obviously, the debate's going to go on. And, gentlemen, we really thank you for joining us for what we believe is a fair and balanced debate. Thank you very much.
Patients in charge. Thanks.
Appreciate it. Thank you. All righty. All right. Now we want to hear from you. What do you think Congress should do now that the Supreme Court has ruled on the health care law? Many of you have already